Hey team, welcome to another episode of It's All About the Team. And we're so fortunate today to have one of the great team members and leaders I've ever been around in my 48 years in higher education. Please welcome Dr. Anita Hackstedde.
I think a good team communicates well with each other.
Someone that wants to be challenged means they want to get better.
People need to see value in what they're doing, whether it's in education or in their business.
Healthcare is so important.
Every job is important. I mean, we don't have a hospital without everybody doing their part, that we're participating in something bigger than ourselves. Life is too important and people are too important to make it all about myself. We're here for a reason, put in our best effort for somebody else, something bigger than us. I think in the end, we'll be happier with ourselves. Thank you very much. Glad to be here.
Well, Dr. Hackstedde, we're going to talk a lot about how you got to this place, but please tell our viewers what's your current position and what's your role today at Salem Regional Hospital.
So I am the president and CEO of Salem Regional Medical Center. I'm a physician by training and background, and now I am fortunate and lucky enough to lead this beautiful facility. So Salem Regional Medical Center is the only independent, nonprofit hospital in the Mahoning Valley, full-service acute care hospital. We have about 800 employees. We're a small community hospital. We have amazing programs here for a small community hospital, but what we are is different because we are a nonprofit and we're independent. We're not controlled by any other system or entity out there, and I think what we have here is a true gem.
Well, it's exciting, and our mission and our goal through the Youngstown Business Journal and out to the rest of the world is to see if we can add value to people who are trying to build teams, whether they're at home or in their organization, their business, their sports team, their state, their country, their nation, their world. And so we haven't had yet someone from healthcare. So I'm so excited about that because I think higher education and healthcare have a lot in common, a lot of challenges and so forth. But whenever we begin, we always say, what was the first lesson about team that you learned at home growing up?
So I think my parents, not necessarily intentionally, but raised me to believe that, we're here for something else, for somebody else. They always viewed that you put in your effort for the company that you work for, the business that you work for your school. You always put forth your best effort. And so that's how I was raised. And I think between my parents and my schooling, that was my belief. And that's still my belief to this day.
Well, and that's what being a team member is all about is, what can I do on behalf of the others, on behalf of the group? And so as you moved on and you have your own team at home.
Yeah.
And it's a different time. We grew up at a different time than is today. And do you see any differences in how one builds a team at home today than when we grew up?
So I would say not too much. I do think everybody has to have their voice. And I think if you're going to have a team, you have to listen to each other. And listening is the hardest thing that we do. We can maybe hear things but not pay attention or listen. But if you're really listening to the input of folks, and I do think that that's the same, you're still going to get a better result from that. But you have to be open-minded to that. And I do think that you have to have that attitude of gratitude, being grateful for what you have, grateful for what you do. If you start your day that way, everything goes much more smoothly. So I think teamwork, it is a complex subject, and I've never really thought too much of it when it comes to how I do my work or how I do my home. I think it's more, I care what people believe and feel and think. And the last thing I want to do is exclude those individuals. I want to see, because they may change my mind on something. So I think a good team communicates well with each other. And through thick or thin, good or bad, you have to be able to do that.
Well, my passion is education, and we look at this podcast as being an educational podcast. There are a lot of podcasts that entertain you, and they're mindless, and it's great. It's we all need to relax and listen and so forth. But as I think about education, and as you think back to your education, which made a big difference in your life, where you are today, if it weren't for education, and you've chosen to serve on our Youngstown State University board, so you obviously believe in education. Where have we, or do we, or should we teach the concept of team in education as you think about it?
That's That's a little bit tougher because I don't know that you can necessarily teach it. You have to kind of do it, in my mind. And I do believe that people need to see value in what they're doing, whether it's in education or in their business. And I think if we can allow our students and our community to see the value that they have, what does this bring to them? And I do think that that makes a bigger difference. But I think doing it more than teaching it. You can sit in the classroom all you want, but until you're thrown into that mix. And that's where I think things like doing internships at facilities or being involved and engaged, you learn how to do that. You have to be able to work with people from all types of diverse backgrounds, and they're going to have different opinions. And how do you navigate through that? Shielding people from conflict doesn't get you anywhere. You have to learn how to do conflict resolution and listen to other folks and make compromises. And the only way you're going to do that is by actually living it. So I think things like internships, involvement, leadership academies, things where they can actually work on projects together, I think that's what makes a difference. I've seen that happen at my own hospital where I work. The more we do things together and involve different departments that aren't used to working with each other, the outcomes can be pretty amazing. So I think doing it is more important.
You know, one of the great lessons I learned about team was when I was the vice president at University of Akron back in 2012 and 13, we had the director of the medical programs of the University of Washington Health Systems, which took in their med school and their dental school and their podiatry and their nursing school and their pharmacy school and all of them, right? And she was talking with us about the fact that somewhere in the top 10 reasons for deaths in America are mistakes made in hospitals.
Yep.
And her hypothesis was that we didn't do as good enough job training in our medical field of people working together. So they totally changed their curriculum.
Agree.
And they made all of the courses have people from all of the various disciplines involved. So you might have a pharmacist with a respiratory tech person, with a pre-med person, with someone who's in med school. And I was thinking, listening to her, I said, well, that makes perfect sense because in coaching, the quarterback doesn't practice by himself.
Right.
And if he did, of course we're going to have mistakes when we go out there. And so within the training you've seen and you had at med school, are we infusing that opportunity for the different people who are going to work together when it's really important, having those experiences?
I think we're doing it now. I don't think we did it back then. So this all came out. It was an Institute of Medicine report called To Err is Human. So in healthcare, we're human beings, and we're going to make mistakes or take shortcuts. That's human nature, and you have to understand we're fallible. That's going to happen. And so what you do is you put systems and processes in place that try to catch you before you get to that point of error. It's what they did historically in the airline industry, but we've started to add a lot of that in healthcare. So we have a program that we brought here to our hospital, I don't even know, maybe it's been 10 years. It's called Team Steps. And it talks about the biggest keys to that are communication and using the right words and feeling free to speak your mind. And back in the old days of medicine, a lot of hierarchy. You know, doctors here, and then everybody reports back. And if somebody sees the doctor maybe not doing something right, we don't speak up. Nowadays it's very different. It's, pull the cord. It's time to stop the line. It's why we do timeouts before surgery. Let's do a timeout. Everybody stops. Do we have everything that we need? I think we're seeing that and recognizing it more now. And we've seen improvements in the outcomes by doing that. So Team Steps is just one example that we use in healthcare, but I do believe that they're training that way now. I don't think it was when I was in school back then. Yeah.
We've talked with many of our guests about, I think everyone agrees that the importance of working together and working as a
Sounds
team.
Good.
Yeah, right.
Sounds good.
But where do we intentionally do that? And, for our viewers, Team Steps, I don't care what your business is. I don't care what you're working on, whether it's at home. Team Steps. Intentional.
And you have to be trained. There's a very structured program that you go through. And, you don't think some of it's common sense, but how to use it is where we struggle. So through that structured program, you learn how to use it, how to use these phrases and these words and how to get the attention that you need. We have a lot of safety mechanisms in place at the hospital. People have to feel free to say, I made a mistake. And back in the day, you got in trouble if you made mistakes. But we're humans. We're going to make mistakes. And so we want them to feel free to report, hey, I made this error. And so we do something that's called a just culture. And so a just culture recognizes that we're all humans and we're all valuable. And most of the time when we make mistakes, it's about coaching and education and all of that. Very rarely should it be disciplinary. Discipline is intentional negligence trying to harm somebody.
Right.
So I think that's important, but you have to feel free to speak up and speak your mind. And there's a way to do that with civility and being professional about it. But those are key. And I think it comes down to people really understanding the significance of what they're doing, whatever their job is. Every job is important. I mean, we don't have a hospital without everybody doing their part. And so there is no one team member who's more valuable than the other. So we all have to do our part and feel that value from it, that we're participating in something bigger than ourselves.
So as you think back to, you went to Youngstown State University and then on to the Ohio State University for medical school. Do you recall that there was any of that type of training, whether it was undergrad or in med school, of building team?
No, honestly, no, I don't. I feel like I had good teams and I had good mentors who acted out, the team philosophy. But as far as specific training, absolutely not. We didn't talk about mistakes in healthcare, but we make them. It seems a lot more open than it used to be, which I think is a good thing. We have to pull off the cover and dig deep inside and see how we can make it better. I do believe that they're doing it now, which is a nice thing to see.
Well, having worked with me for 8.7
Yeah,
years or
8.7
however
years.
long I lasted as the president there, that I believe in teams.
Yes,
whether it's
absolutely.
engineering teams or sports teams or musical teams or whatever. And I'm not so sure whether it's in our K through 12 or our higher ed or our professional schools that everyone should be mandated to be a part of teams.
Right.
Whether it's in engineering,
It's how you work together.
You need to be on one of those 9 competitive engineering teams, and that's what we're trying to bring attention to and add value to with this podcast is the intentionality of all of us to find ways to infuse that value into how we do whatever it is we do, whether it's education, business, healthcare, or the rest. And so if we're doing better now, and I know after you left med school, you went
to Akron for training.
That's where you did your residency?
Yes.
Akron
General and children's. I did both.
Okay.
I did a combined program.
All right. So when you got there for training, was there an infusion of that team yet?
So in medicine, there's a team just because we have teams of people who take care of patients. So I'm assigned on a unit, and I have my attending physician. I'm the head resident, and then I have my intern. So there's automatic teams. And so we kind of learned this skill as we went along. So we were taught, okay, how do we present cases? How do we talk about this? That's where I started to see more of the actual team because now I had more responsibility and more of a role in it versus kind of just trying to absorb the education of it. I was actually doing it. And so I did see it more there. I had great mentors who really felt like if we can bring everybody together and listen to each other, the role of teams is critical. If you think about it, when kids are little, they learn how to play on teams on their own. They're outside playing in the yard, and they automatically have teams where you're playing in games. Those are teams, and people I think too hard about this. And what you're really learning how to do is how to resolve conflicts, how to identify a similar goal, okay? So in healthcare, we want to make our patient better. That's our goal. And we might have a differing opinion on how to get there. So how do we talk through that and come to an agreement at the end? And that's the whole point of a team. It doesn't have to have this really technical definition to it. It's not a difficult concept if you just break it down to the basics. So we did do that, and I think we see a lot more intentionality now that we're thinking about it, so we can understand it better. And how do we even improve upon what we've done? I think that's important.
It's a little bit of a hot button nerve thing for me when you brought up that resolving conflicts.
Yes.
Because I think back to being a kid, where we'd go out and play baseball, and we didn't have enough guys to have a whole team, so right field was dead, and pitcher's mound was poisoned because we didn't have enough for the first base, and then whether there was a debate about whether he was out safe, it was a fair ball, foul ball.
You're going to disagree.
Sometimes you threw the bat up, and you caught it, and then you did one of these kind of things. But anyway, you figured out.
You figured it out.
And we've evolved to youth baseball, having 11 coaches who are all the moms or dads of the kids, and they're not letting the people learn that part of the teamwork of that resolving the conflict.
They have to have the freedom to be able to do it on their own. I remember watching my kids out the kitchen window, and I could see them getting into a little tiff with the neighborhood kids, and my first reaction is, I got to go out, save my kid. No, absolutely not. You have to hold yourself back, because they need to figure out how to do that. It's the whole part of socialization that we need to do, and I think would resolve a lot of issues that we see today. We can have disagreements, but we can be respectful and civil about it. And I may change your mind, I may not change your mind, and that's okay. We can be different, but we have to come up with a compromise, because you're not going to do what I want to do, I'm not going to do what you want to do, so we have to come up with a way that we can get it done. And I think the best way to do it is you've got to let people be free and learn how to do it and figure it out. And that's where the value truly is, in those frontline people figuring out the job, the work, whatever needs to be done. That's the value right there. They know how to do their jobs. Let them figure it out. Sometimes you need a little guidance to keep them, in the guardrails, and to keep them from going too far out of bounds. That was a sports analogy right there for me.
I get that. That's pretty good.
But it's not too complex, but you have to let people do it. And so I'm not a dictator here. I'm not here to tell you what to do. Tell me what you want to do. I'll tell you if I agree with it or not, and why I disagree with it. And if you convince me, we're going to do it your way. Or if I convince you, we'll do it my way, or come up with something in between. So you have to be able to do that. Conflict resolution, I think, is critical. I really do.
Well, and a large majority of our guests from lots of different fields said very similar things, in that they needed to hear from the team members. They needed to get the team members' ideas, and they also at times needed to clarify what team members were thinking, because perhaps they didn't have the data or the, information, the experience, whatever it happened to be. But so all that education, K through 12, YSU grad, Ohio State grad, residencies and so forth, then when you headed out of education, where'd you go?
So I started off in practice in Boardman.
In Boardman.
I did teaching with the Children's Hospital, taught children's when it existed, and then teaching through the internal medicine program, and then had a practice in Boardman for several years. Loved it. It was awesome. Got to take care of a lot of people, and then I came to Salem after that.
So that first team outside of your educational process, anything that was like, whoa, this is the real world, and I learned this lesson about being a part of a team?
Well, so I come out and I'm starting a practice in an area. I'm from the area, but I didn't train here, so I didn't know all the specialists. I didn't know a lot of things. Saw things in practice that maybe I wasn't trained to do, so I kind of had to learn how to, number one, think on my feet, how to solve a problem, and then how to reach out to people. And so, placing calls to a specialist because I had a question and this person doesn't know who I am, and they're so kind and they take my call. So it's the communication skills that get you out. And I realized, wow, I can just, if I have a complex patient, I'm just going to refer them to a specialist and not do anything about it. Or I can pick up the phone and call the specialist and say, hey, I have this case, I'm not really sure what to do. This is why I'm sending them to you. Or I write a letter to them and explain it. That solves so many issues. Too many people try to take the shortcuts and just say, just send them to the specialist. And you can apply that to your own, career, your own field. But talking to those other individuals, they know what I'm thinking, where my mind is, and this is what's going on. My patients know they're being handed off. So handoffs are critical. Whether it's in football or anything else, the handoff makes the difference. So I want to make sure that whatever I have, the information I have, I need to make sure that you understand where I'm coming from, so you can then take it to the next level. So I think learning how to do the communication and the handoffs was critical.
And that willingness of those people who you were kind of trying to join their team.
Yeah, they didn't know me.
The medical community
They were wonderful,
team.
but they didn't know me.
Thank goodness.
They gave me a chance.
Right, right.
Yeah.
Hey, teammates, I want to tell you about a project we're working on with Youngstown State University. One of the ways Ellen and I have decided to give back is through the Tressel Institute for Leadership and Teamwork. We've collected a set of successful business and nonprofit leaders to serve as guest servant leaders in partnership with the Sokolov Honors College to teach university students teamwork,
leadership, and personal skills. We teach from a foundation built on gratitude, excellence, hope, love, and selflessness. If you're a young person or parent helping to search for a unique college experience, you can learn more at tresselinstitute.ysu.edu or ysu.edu. Links will be provided in the show notes.
So when you came to Salem Regional, and all of a sudden now you're responsible for building a team, what was it that you were looking for across the wide array of positions that needed to be put together?
I came in as the chief medical officer first, so I was in charge of the quality of care and things like that. And I started looking at things, and I thought, wow, it's being run like a business, which it is. Healthcare's a business, just like education's a business. But we're forgetting about the product that we produce. And so we don't produce a widget. We take care of people's lives here. That's huge, okay? And to me, there's no more noble cause out there. And I have a passion for that. So I may not take care of patients directly now, but I do feel responsibility for all the patients. So I wanted to make a difference and say, look, we're a service organization. We have to get back to a service mentality, not a check the box, I did my task, I'm off. So I needed to have individuals who had that same philosophy and understood where our priorities are. And the priority is the patient. And one of the things I constantly say to folks here is every decision that I make, whether it's I'm going to build a building, start a new service line, or talking about if I have to do bad or hard decisions, if you think about what's best for the patient first, because that's our ultimate goal, you'll never make a bad decision. So talking to other folks who had that same philosophy, and I can tell you I had some really great people here that really rose to the top, and that is their belief. And then the part that's not hard, I love my job. I love getting up every day and coming to work. If I didn't love my job, I wouldn't be here. But I choose to love my job. I choose my attitude when I come in, and I tell every new orientee that comes in when I go to orientation, if you remember nothing else from my orientation, remember 2 words: be kind. Be kind to your coworkers, be kind to the patients, be kind to their families. Your day will go much easier if you're kind. It's not about everybody else. It's even just about me. This is not difficult. Too often we love like the drama and things that go with that. But when you're kind, your teammates respond. So somebody drops paper, I bend over and I pick it up. Somebody needs the door held open, I do that. I have a lost patient who can't find their way. I'm going to walk them to where they need to go. They're scared. Nobody comes here because they want to be here.
Right.
It's the one thing that's different about our place. And if you go in with that attitude, and that's why I talk about the gratitude, because that makes a difference. I'm grateful every day that I get to work with brilliant people who love what they do. They have a passion for what they do, and we can do great work together. If you come in with that attitude, your day just goes much better, and the outcomes are better all around.
So many of our guests have talked about that very thing of they wanted to make sure that they were building a team of people with like-minded mission belief.
But I like people who disagree with me.
Yeah, right. Like-minded mission in terms of the customer or the patient. And the hard part, as I listen to them, is how do you, in an interviewing process, how do you find that answer out of bringing the right team members?
It's really hard during an interview because it's too short of a time. The longer you spend with somebody, it's almost like you have to get to know them as a human being, not as the job description and what their views and philosophies are. So you kind of have to really get to the nitty-gritty and try to get that person to open up to you about who they are. And when I said I like people who disagree with me, when I first became CEO here, the biggest obstacle I saw is people don't want to tell me, hey, Anita, I think you're wrong. They didn't want to say that because they were afraid. So they had to feel safe. They had to feel safe that I'm not here to, you disagree with me, you're done. That doesn't make any sense. But, and I can tell you, people would say, look, I think you're wrong about this. And they've changed my mind. And I'm like, you know what? You're right about that. So as a leader, if you're going to lead the team, you have to be open-minded. You have to get that feedback. Trying to figure out if a new hire is going to be that kind of person, that's a tough one. I'm all for doing personality testing and all of that. We don't do it, but I think it's great. I think you learn more about yourself than anything else. I know when I came here, they actually ran me through a bunch of personality tests so I could understand my weaknesses and my strengths. Because the strengths are easy, it's the weaknesses. And so how do I deal with those weaknesses? And I'm cognizant of it, and I try to adjust to it. But it's I still come back to, if you just care about people, you care about what you do, you care about something beside yourself, I think you're going to do a great job, and you'll be a great either team leader or team member. But you have to, it's that selflessness, that intentional selflessness that you talk about. And I think some of us are born with that. Others have to learn that. But you can teach it. You can teach it.
Well, and that's what you hope you can learn as you are figuring out building your team.
Yeah.
But like you say, sometimes short interviews. We used to do these, I think they were called behavioral assessment things with our coaches and our players. And it was not so much to think about strengths and weaknesses. It was to think about just how they think.
Yeah.
Not that it's a strength or a weakness, but we had some guys that did not have an innate need for information. That was just not something that was not part. So you had to figure out a way for them to want information.
Yes.
Because we need information. There's some that were on the extreme end of being perfectionists.
Right.
Well, every play is not going to work. So we're going to have to learn how to, to deal with that. And so we tried to use those tools, but quite honestly, getting to know them as much as you could. And that's why we started recruiting kids when they were younger and get to know their families and see how they act and go to their school and talk to the cafeteria worker and say, hey, have you ever met Johnny? Oh, yeah, Johnny's always so nice to me. He picks up the trays. Okay, I think Johnny could, buy into what we're trying to do. But getting the right people on the team, it is so critical. And
if you recognize that the humanity of all of us, okay? And so it's just, again, it goes back to the golden rule and being kind and treating others the way you want to be treated. When you get to know somebody, then you can understand why they're making the decisions they're making, or why they're looking at something through maybe jaded lenses versus somebody who's, my glass is half full all the time and yours is half empty all the time. There's value to that, but it's understanding who you are as a person and then figuring out, okay, what's my best way to communicate with you? It might not be the same way I do that with somebody else. And it's so simple in my mind, but it's very complex. But it comes down to caring about them as individuals and people. And the last thing I want to do is to make you feel bad as a person.
Right.
Okay, because that makes me feel bad. It's selfish. That makes me feel bad.
Right.
So I want to make you feel good. So, there's a person here at work once told me, there's two ways to get ahead in the world. You can either rise up and do great work and do great things, or you can cut the legs out from the people around you.
Right.
And I don't want to cut the legs out from the people around you. When my team does well, and I think my board would say that this is how I am. I'm a we kind of person. It's an I when I fail, but it's a we when we're doing great work. Because if they do great work, guess what? I shine too. So it's a good thing. And it's about inspiration and motivation, but a lot of it has to come from internally. So how do you get the person to be internally motivated? So you could do things because you're going to get in trouble if you don't do it. Or, there's the different models, but how do I get you to the point where you want to do it because it's the right thing, it's the best thing, you're inspired to do it? That's the tough part. I don't know that everybody can do it, but we all have a role on the team, even if that's not us. There's still a position for us on that team. So it's finding the right position for people. That's tough. Because maybe we put somebody in a bad position and we're setting them up for failure, so then we have to go, oh, that's not working out. But let's really look at what their skills are and let's match their skills to the duties that they have to do. There's a role for everybody. It's incumbent on us as leaders to figure out what that role is.
Well, I love the part when you said you like people that will challenge you because you can learn from them, right? And I think it also is a signal that they want to be challenged.
Yeah.
And someone that wants to be challenged means they want to get better.
Yeah.
Because they're thinking about it.
Like, I love the debates. I grew up, so both of my parents were from Italy. My dad had the typical harsh Italian accent, and I used to call him the philosophizer because he would just sit around and want to talk about whatever subject came up. And whatever I said, he was going to argue the opposite.
Right.
And so you learn how to do that.
Yep.
And it was done out of love, and we just love doing that. And so to this day, I like to argue. It's what I do. So if you let people see that, and it's not a threat. It's not a threat. It's just a way that we can exchange ideas and thinking and challenge each other. You grow so much more when you do that. If it's just the same old all the time, there's no growth. I'm a believer in you continuously have to grow. Life is growth. You just have to grow. And I think if people could get to more of that, they would enjoy it.
So let's get to a different responsibility. we've talked about the boards you're on.
Mm-hmm.
So I was blessed to have you on our Youngstown State University board, and you're on the Ohio Hospital
I just brand new Ohio Hospital Association board. Mm-hmm.
Plus, you have your own board.
My own board here. Mm-hmm.
Okay, so let's talk about what you think you've learned about where a board can impact in the building of a team.
Well, I do believe, so I try to learn from every leader that I'm around, and I try to observe how they do things to see, okay, that's a unique skill. I don't do it that way. So number one, I try to observe a lot of that. I learned a lot from you. But I think as a board, number one, if you're selecting the leader of the group, which they are, okay, the boards select the leaders, you have to support that leader and give them at least the freedom to be able to do what they feel is best for the organizations and explain it. So I view my role as a board member to be supportive, but I'm going to give you my opinion if I think something's wrong, okay? But I have to understand we don't all think alike. In the end, we want the same thing, the success of the program, the organization, whatever. But I do think board members, there are those that come in with a frictional personality. I've seen it at every board I've been on, and it's more of that kind of environment. I don't think that gets us anywhere, not in life or in relationships, anything. I come in with, okay, what are we trying to accomplish? How do you think we should get there? This is what I think. But in the end, you're the one in charge. Let's see how you do it. Let me give you a chance. I used to do this with my residents. They would present my patients. They were my patients. So my residents in training would come to me and say, they'd present the case to me. I go, well, you just presented the case. I want to know what you think and what you want to do. Mm-hmm. And if it might not be what I would do, but if it's on the right path or I don't think it's a problem, we're going to do it your way. Mm-hmm. And so there's nothing wrong with it. That's how they learn, and they can grow. I think the board's purpose is to support, to guide, to lead. I have experts from all different fields on my board, and they are not shy. I have a marvelous board at the hospital that they tell me what they think. They give their opinion. I ask them questions. They're vocal, but they're so supportive. It's unbelievable. So they're here to make sure that I am successful because they want the hospital to be successful. So I feel like we're all on the same page.
One of the things I thought you did best on our board was that you challenged us as an administration, but you also, when you were chair, challenged the board, which I've since been on some other boards, and I've heard we hired the CEO and then we're going to leave him or her alone and, then evaluate it later. Yeah. And I'm thinking, well, no, one thing I learned as a president that I needed to learn a lot because I'd never done something like that, but that if I didn't have a great board who brought great expertise, who would challenge me, who would challenge one another, I hope I didn't have a bunch of clones. You wanted a lot of people that, thought differently. And it's just been at this late part of my life that I had a chance to work with boards. But to me, I see what an importance it is on the building of a team.
Yeah.
I'm sure the same is in a business or a healthcare system or so you're now on the Ohio Hospital Association board and you're with some that have 100,000.
Oh yeah.
Right?
Cleveland Clinic, Ohio State.
Yeah,
the
right.
big guys.
Right.
Yeah.
So to me that's intriguing of how do we build a team of healthcare systems?
Right. We did a great job during COVID, and I thought we'd be done talking about COVID, but I have to say, Ohio, we went through so much during COVID, and I don't think people understand the strain, especially as tiny little hospitals. I remember looking at my team, and I'd said to them, I feel like, the wave has gone out, and we're just waiting for the tsunami to come in. We're just waiting. And it stretched our resources so thin, but Ohio, we've always had a good group of organizations that work together. When we needed help, when there was a big outbreak and we were being inundated as a tiny hospital, we reached out to the bigger hospital and said, hey, we are struggling. We need some help. The governor came in. We got our zones in place. We had this whole process, and it was a communication tool. And I thought that was one of the best things to come out of that is we learned, even though we compete on things, we're here to help. In the end, we all want the same thing. We want a healthy community who does well. And so if we can get past everything else, and they did, everybody rose up. It was so beautiful to see small hospitals helping big hospitals helping the medium hospitals. It was all over the place. And it was a great coordination of effort because we had the same goal. And in the end, that's what your team is supposed to do. We have the same goal, and everything else went away. And what was most valuable and most important were the human lives, and we all recognize that. And it's like, how do we get there? And so post-COVID, you had a fractionation of all the teams because healthcare workers were leaving in droves.
Yeah.
How do you convince them to come back into this world,
I know.
which is extraordinarily stressful?
Yeah.
And that was our biggest problem, was recovering from that impact. And we still haven't fully recovered. No hospital has. And so it's a different mindset now. And so how do we get to that point and work together? Because we all, in the end, do want the same thing. And if we can remember that, our approaches may be different, but we're trying to do that. So I do believe that we all can work together, the big guys, the little guys. There's a place for all of us, a place for every one of us, and there's value to each of us. And yes, we're going to compete because we have to. It's what we do. But in the end, I think we're all here to support each other. We want everybody to survive. That's the goal.
And you know, that was one of the bonuses we had at Youngstown State with you on our board during COVID. Because how many times did I text you, do you have time for a call, right? Because we were working with the public health department.
Yeah,
we
it was
were
all
working
over the place. Information everywhere.
The universities, the presidents were on these calls, and it was a horrible time, but it was a
Learned
time
so much
to really learn about team.
We really did.
You know, it really. So, here's what I want to end with. And I might not be ending with this because I just thought of another question. But so, healthcare is so important. Sometimes you don't know how important it is until you need it.
Right.
Like many things. How can we, in education and maybe in our own family teams, help young people think about going in and being a part of that team? Why would it be exciting to be on a healthcare team? I'm talking to a young person who we want to attract to, our nursing school or our respiratory therapy or our physician's assistant or, whatever.
I don't think people realize how much we make a difference in people's lives. It's not too many jobs where you can see that direct impact. And I think if you really truly want to do something that's bigger than yourself, okay, which that's how I am. I want to do something more than just for me. It's for something else. I think you'll attract those individuals. We have the drama and the excitement and the chaos. It's typical. It's not quite General Hospital, but it can get close. But whether it's helping people, nobody comes to a hospital because, hey, I want to go visit that place. They're having a very, very bad moment. Okay, it's a critical time in their lives, and we can have an impact one way or the other. One person wrote us a letter. I'll never forget this. I still have the letter to this day. And her father was dying, and it was a really tough time on the family. Nothing could be done. Terminal end stage, he was going to die. And she wrote me a letter to thank our employees and said that we knew how to help our father live, but what we didn't know was how to help him die. And that's where our staff came in. That moved me more than anything I've ever done in healthcare, because I thought, wow, that's the significance. We can't fix them, but we can help them get to that next stage. And I remember sharing that with our staff. And to me, that's where we make a difference. In healthcare, we do that. You get to know people intimately well during the most critical time in their life, and you can have an impact. And to me, I want to have a positive impact, and that's what we try to do. And so I think that's how we convince these kids.
It reminds me of something that I just experienced. So I was going over to visit with Coach Day and the Ohio State team, and I go over every other Tuesday just to, be a resource and encourage and all the rest. And so I was on my way, and I got a text from an old player. And he said, hey, there's a lady who was a oncology nurse that treated your mom back in 2001 when she was at the James Cancer Hospital at Ohio State, and now she's the patient.
Wow.
Do you think there's any way you could stop up and see her if you're ever going to Columbus? Well, I was riding to Columbus. And I was like, well, when I was the head coach, I couldn't be late for practice, but I'm not the head coach anymore. I'm going to go stop by. And just to see that, transition from spending. And she said an interesting thing. She said, people would ask me all the time why I would want to be an oncology nurse. You know, it's in that difficult time, and it's just, you know, a lot of tough moments, and her thing was, hey, I want to be there at the most difficult times to see if I can make a difference. And I remember my mom saying on her last day or two, I just need to keep going because I don't want to let these nurses down. And it was like, and then 23 years later, full circle, I'm seeing the nurse that, and that's a big reason, right? Making a difference.
Making a difference.
You know, lifelong difference. And so I'm going to give you the last word.
Okay.
Okay. If you had to just give us a closing argument why it's all about the team, why don't you look right into the camera with our viewers, and final reason it's all about the team.
That's a tough one. It's
well, that's
all
what we
about
do
the
here.
team.
We try to
I
we try to challenge our teammates.
Because I think life is too important and people are too important to make it all about myself. And I think in the end, we're here for a reason. And if we contribute and participate and put in our best effort for somebody else, something bigger than us, I think in the end, we'll be happier with ourselves. And I think it makes a difference, and it makes the world a better place.
Hey, teammates, I told you, you were in for a treat, and you certainly were. Until the next time, let's remember, it's all about the team.